Thank you for joining us today. My name is Jennifer Dick. My background is in nursing, and I'm a certified occupational health nurse and prevention consultant with Safe Work Manitoba.
Hi, Jen. My name is Mike Pogorzellik. My background is in pharmacology and microbiology. I'm a certified health and safety consultant and work as a prevention consultant at Safe Work Manitoba. Although someone wants help, there are times when they do not know what to say, and because of that, they may not say anything at all. Are you okay is a conversation starter that can be helpful to keep in your toolkit, so you can open the door to communication.
Great point, Mike. We know that communication is often key to creating a positive work culture. And when workers receive clear communication on what to expect and clearly understand what's going on, they may respond better. So, having clear expectations creates an environment where workers know what to do and how to respond.
The Mental Health Commission of Canada provides the following tips for communication as part of the Mental Health First Aid Canada. So, tip number one is approach and assess. You want to invite the person to talk. If there is a risk of suicide or harm, you want to ensure you reach out to first responders.
And we might think about starting our conversation by saying, I've noticed that you say you are sad. How are you doing? And how long have you been feeling this way?
And tip number two is listen without judging. Help the person speak freely by listening and asking questions without judging or telling the person what to do.
A good way to start this conversation is to just reiterate what the person is saying without judgment. It sounds like you're really worried about your job. Is that right?
And tip number three is you want to make sure you're giving reassurance. This helps to counter any shame associated with mental distress, reluctance to talk about, or reluctance to reach out for help.
This is a really hopeful message, and providing reassurance to the person you're speaking to is a good way to start this conversation. Given the situation, it's understandable that you're experiencing this. There are supports available that have helped others.
And tip number four is you want to encourage other supports. You want to help the person to find ways that others can support them during this time.
For sure. And asking the person if they have additional supports is a way for them to reflect and remember that they can reach out within their family, friends, or community. A good way to start this conversation is how might a family member help or a community member?
And finally, the last tip is you want to encourage professional help. Help coworkers to identify appropriate professional supports.
For sure. As Mike said, ensuring that a person knows that there's professional help and encouraging them to seek professional help. This can be done by saying, what has helped in the past? Would it help to call your family doctor or mental health specialist?
And you just want to remember that although it may be difficult to have the conversation, feel free to use these conversation starters and simply maybe just ask, are you okay? To conclude, here's a short video from CCOHS.
Life can be stressful.
It can be hard to cope.
But the workplace can be a place of support.
A place of healing.
Reach out.
Check in. Speak up.
Show you care.
Start with a question.
Are you okay?
Hey, you alright?
You okay?
A few simple words can make a big difference.
Comfort.
Support.
Reassurance.
You're not alone.
Many of us have been there before.
Mental,
Or physical.
Illness is illness.
So go ahead.
Start the conversation.
Hey man, you okay?